Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
Hi there. Welcome to the 66th episode of A Couple Takes on MS. Hi, this is Dan Digman.
And hi, it's me, Jennifer Digman.
Welcome to this show, and what we're actually kind of reeling, because like right now, we honest to goodness just returned from the MS Public Policy Conference in Washington, D.C., annual effort to go out to the nation's capital and meet with our legislators and advocate for legislation that will benefit members of the MS community.
And it's empowering and it's fun. And it was cold. I mean, it was very cold in Washington, D.C.
It was.
But it was so magical, and there were close to 300 activists from across the country. And we all gathered together to make one group effort to take on Capitol Hill, to get our orange out, and to celebrate our togetherness and our spirit, but also to get some movement in legislation for the MS community.
And what we're going to talk about today, we will highlight here the three main issues that we took to our respective legislators just to talk to them, to share our stories, because it's the stories that make the impact, that connect with people, and that which they remember. And just to highlight the three priorities that we had that to take to our legislators. The first one was just access to MS medications, and the request that we took to them was to pass legislation to remove barriers to generics, rein in medication price increases, and cap out-of-pocket costs in Medicare Part D. So that was the first thing. And then we wanted to talk about
the affordable quality health coverage. When we were asking our legislators to introduce legislation to address surprise medical bills.
And the other thing we wanted to talk about, this was our fourth time going to the Public Policy Conference, and this is something that is, I want to say, a staple that we always bring, and it's money for MS research funding. And that which we requested for this year was to have $16 million for the MS research program at the Department of Defense, $41.6 billion for the National Institute of Health, and the reauthorization of the Patient-Centered Outcomes Research Institute, which initials PCORI is how we do it, so we wouldn't have to say the long name. Now that's just, and some of this obviously, it was new to us until we had like all of the background and learning. I mean, they had given us some insight, and we knew about a lot of these things going into it. I'm sure it's probably new to everyone listening, but we wanted to go into this just into more detail so that, you know, we talk about getting home from the conference, but the title of the show is how the PPC continues, because really our work has just begun and we don't work alone. We need everyone else out there too to connect with your legislators to get them to take action.
And I believe, Dan, we have talked about advocacy in the past, and we will continue to talk about it, because advocacy and telling your story and sharing your story with legislators is really important, because as we've said before, no one knows your story better than you do, and it's so powerful. But I think it's very, very important to get involved. to do what you can for your own battle with this disease. And this is just on a grand scale that we all got together to do this. But it can be a little intimidating. I would say the first time, do you remember the first time?
It's very intimidating.
You met with legislators, whether it's at your own state or in the nation's capital. It can be scary. And it's easy to say, oh, these people work for you. But it's still, you need to have your stuff together and you need to be prepared. Because if you're meeting with your congressperson, your congressman, he doesn't have a lot of time for you to try and get your facts in order or your story straight. So, you have to do your homework. And that's why Dan and I are so thankful and appreciative to the National MS Society, because they helped us to get, to rehearse, or not really to rehearse because we didn't have like canned speeches we gave, but just to get our story straight and to know our issues and how to get the most impact and get the most in what we had with that limited time. Not that, legislators limit their time with you, but for heaven's sakes, can't listen to everybody at the same time. So you do have to be really powerful to use your voice.
And I think that's the big thing in telling you as activists, as people in the community, maybe you're not active, yet, because advocacy is, like we've said, it's so empowering, but it's telling your story, and that's what the legislators want to hear, and that's how you communicate this. And so when we talk about one of the three actions was in terms of getting access to MS medications, and one of the biggest things we've all talked, and it's not just within the MS world, it's lowering prescription drug prices. And the big thing with this is, think about, it's like with our medication, those of us in the MS community, it's expensive. It's really expensive.
It's
and
very
the big
expensive.
thing, and just one of the stories, and the story that we shared in meeting with one of our senators, Senator Debbie Stabenow here in Michigan, made the point that when I first started taking my medication, I take beta-seron.
Yes.
And when that drug was first brought out onto the market back in 1993, the first drug to slow MS progression, the annual cost was around $10,000 a year. Fast forward now to 2019.
Yes.
Some 26 years later, that drug that cost back in 1993 around $10,000 a year is now approximately $90,000 a year, and that's an increase of over 880% increase. And this medication has not changed in formulary since 1993, yet it's charging that great of an
increase, and it's just astronomical. And it's not just, we're not calling out a single disease-modifying therapy, but in Dan's case, he takes beta-seron, and that's a perfect example. But you can see in the approved or the available medications, 14?
There's at least 14, yes.
All of the prices are astronomical, skyrocketing, and they brought generic of one form of the medication. They brought out a generic form. So you would think generics cheaper. No, not so much. That's still at a really quite a very high price, and it hasn't helped to lower the cost of the medications. And so that's why we really wanted to make this an issue. And I know that President Trump in his State of the Union address talked about how we need to lower medication costs. And it's especially important to those of us in the MS community because we do take these specialty drugs to treat our disease, and they are typically very, very expensive. And you administer many of them yourself, or if you go into the doctor's office or to the infusion center at your hospital, it's still, really expensive. And it doesn't make a difference which method you choose to deliver the medicine. And that I think your story, Dan, I mean, that's just crazy. If you bought a car, I don't know how many of you bought a car in 1993, but yes, the price went up in 2019, but it didn't go up 800%.
For the same car that was produced in 1993.
And we heard Congressman Dan Kildee speak to rally the troops before we went out and legislated. He also is from Michigan. We heard him speak to rally the troops before we went out on Capitol Hill. And he talked about how important affordable medication is. And what was the example he used about the house?
He had talked about when we say like getting access, and a lot of the people who maybe are opposed to controlling prescription drug prices, and they say, well, we just want to provide access to the medication. Everybody has access to the medication, and it's and he had made the comparison. He said that everybody in the world, or everybody in the United States, has access to buy a $50 million house.
But it's not realistic.
It's not realistic that everyone is going to can afford to buy a $50 million house. Same thing, to say we have access to this medication.
This medication that is improving the quality of our lives and, improving our day-to-day activities, makes living with multiple sclerosis easier or better, I would say. It lengthens the time between activity and lessens the severity of the disease. So yeah, it's pretty darn important to those of us living with multiple sclerosis.
And to which, we're grateful. I mean, the drugs are available, the drugs are working, but at what cost? It's like, some of the information, it's like among those in employer insurance plans, a person with MS spends 3 times as much out of pocket than the average person does. And in 2019, prices increased for 5 of the MS medications are higher than the rate of medical inflation, including a drug that's been on the market for more than 25 years. And so
yes.
that would be my medication. So that was a big thing. That's what we had talked about with our legislators, is just like with President Trump wanting prescription drug price control. That and then we hear
it's a bipartisan issue.
I was going to say, and dealing because Congressman Kildee is a Democrat, and hopefully this is something that is very bipartisan, that they can take some action on it, so that when should we go to a public policy conference again, we're not talking about prescription drug price legislation, that it will be taken care of, or moving in the right direction.
Yes.
So
and that would be amazing.
And we could talk about this forever, but we had other issues, and this was talking about introducing legislation to address surprise medical bills. And this is something that, when we brought this up, we met with 5 legislators. We met with, face to face with 2 senators and 2 congressmen, and then one of the legislative aides for another congressman. And when we're talking about this, every time we started to talk about surprise medical bills, they all just started shaking their heads, because they know this is a big deal and it's coming around to where, just for example, if I were to go to a hospital that's in my network, in network for my insurance, and so I'm thinking I got good coverage and I'll have things covered within my co-pays, etc. But then just all of a sudden, one of the specialists, I could see like a fleet of doctors at the hospital.
In network doctors.
And network, and they could be, but then just one of the professionals, one of the doctors I see, unbeknownst to me, was actually an out-of-network doctor, and then I get socked with the whole bill because, or paying the out-of-price things because they were out of network.
And that is why we wanted to address this. And, according to a Kaiser Family Foundation survey, nearly 7 in 10 people with unaffordable out-of-network medical bills were unaware the provider that they saw were out of service. So, when you go in to get help and you think, oh, I'm seeing a doctor that's in my network, and then you get home and maybe a month later you get a bill, like a really expensive bill or just a bill in general, and you're like, oh, I thought this doctor was in my network, but surprise, he or she wasn't. So hopefully the legislators can address this and make it not a problem. And it is a problem. And, there are some states, what is there, like 25 states that do not have surprise billing protections. And, that means that 25 states do. But we need to get this across the board so that we can all be protected.
Yeah, because I think with this, those of us with MS, as we just got done talking about the, huge cost for prescription medications for us, that there's even more critical because found that there's a study in the journal Multiple Sclerosis Related Disorders found that individuals with MS had 5.1 times higher direct medical expenditures than those without MS. So that says that those of us with MS need this protection because with that size of out-of-pocket expenditures that much higher, and this is a big deal.
Yeah, and as if, people with multiple sclerosis don't do well with stress, but then to surprise get a bill, that's more stressful, and that's going to have the potential to worsen our MS. And really, even those of us, or well, not those of us, because I am living with MS, but though the people in the community as a whole, whether you have MS or another chronic illness, or you're perfectly healthy, none of us need to live with surprise billing. And so that was one of the issues. But as Dan alluded to or mentioned earlier, the big annual ask is for increased research funding. Support $16 billion for the MS research program at the Department of Defense. Because there is evidence that has linked people who have been in the military are turning up what is like with higher numbers of multiple sclerosis. And so that's why this funding is going through the Department of Defense. It's just kind of an interesting, when you say interesting link between the two.
Absolutely. And and we're talking about money, billions of dollars for the National Institutes of Health. I think this number says 41.6 billion, but I know we were asking for even more than that. And I think what it is, talking the billions of dollars, is for collective for NIH research, and that was one thing we had recognized the MS representative of the year. And he had commented that he had just asked one of his colleagues in dealing with funding for research. He says it was like, would you rather fund the
research? Yeah, Dan, I know it's a really good quote, and you can just check really quick what it was.
I'm looking up.
But we're just, if you aren't aware that the NIH, it's the country's premier institution for medical research, and it's the single largest source of biomedical research funding in the world. And so they aren't just researching multiple sclerosis, they're looking into Parkinson's, they're looking into cancer, they're looking into diabetes. And what's really awesome is this big ask for this money. I think we're asking this much because we don't want it just exclusively MS. We want this money so that the National Institute of Health can find more information to help all of these diseases.
And
Did you find the quote?
I did, and this is because I remember he was from Oklahoma.
Okay.
Because we know activists. Hi, Patty Barker from Oklahoma. But he's Representative Tom Cole. And the quote that and we had tweeted on this, and he had just asked his colleagues, he's like, would you rather fund research or disease? Because it's just like, if people get the disease, then all of a sudden the government's, funding for that to fix the disease. And it's like, do the research. And that's the thing that what I always take comfort in. Maybe it's our particular legislators and senators and everything that we work with. I don't think that there's a question of the use and the need and dollars for medical research. And this is where, you talked earlier about advocates and, being there to, put the work in and, be your own best advocate and everything. And I think that's where, and so we're doing our part. We're working for this. And it's just like, that's where the MS Society has invested $1 billion of money for research. So it's not like we as the MS
That we're
Society
just
is just
asking.
asking government, give us money, give us money, give us money. We're doing our part, to help in this effort. We need, your help, and that's where
I think a really big point that was made at this year's public policy conference is the fact that there's evidence that proves that 1 million people are diagnosed and living with multiple sclerosis in the United States. 1 million people. They're confident with that number. And it's, 5 years ago, they were saying that they thought there were half that many. But it's really that high. And so, what was it? Twice as many people as we used to think. And so we need twice as much money. 1 million people are living with multiple sclerosis. So this research funding is going to impact the lives of so many people, whether it be the person living with the disease or the caregiver or the family. It's just a trickle-down effect.
And that's where, and the article came out in the Journal of Neurology. Actually, was yesterday on March
5th.
March 5th. Because we had been living for years, like for 20 plus years,
Yes.
or average of 20 between the two of us, 19 and 21 respectively.
The average of 20.
Exactly. But just that we had been living with thinking, they were saying 400 to 500,000, and boom, just like that, with not just like that, because it's taken years of research looking into these numbers, and this is like, this is real. This is not just a niche market of those of us with MS. This is a big community, and
it's a big community that needs help, and we need the funding. We need the research. We need to know the genetic components. We need to know the geographic. I mean, there's so many different ways that need to be funded. And I wish I could remember who said it, but there was one legislator that was talking, I believe, with the National Institute of Health. They get all these proposals for different research that they should do, and let's say they get 100 proposals. Well, they know they only have money to do so much, so they have to weed down the pile of 100 down to 50, and then they look at their money that they have financing, and then the pile goes down to 25, and then eventually it'll go down to, let's say, 5. And the doctor that was in charge of that was just saying, well, what if that number 6 proposal, which we couldn't fund, was the one that would have the cure, or that would unlock some huge part of the mystery that is multiple sclerosis. And that's really deep when you think about that. Like, those researchers that are working on this crazy, National Institute of Health research, they need that money to help get the clues or the information to help these diseases.
And that's why we're there. And I think it's just that continued encouragement. And now, like I say, we were at the conference, but the efforts are just starting. And so we really encourage all of you to get involved, to take action, go to the National MS Society.
See how you can get involved. Advocacy, you can do it from your own home or go to your state's capital, or someday go local. Just get your voice heard. Tell others what the reality of living with multiple sclerosis is, especially this month, because this is MS Awareness Month.
And this gives you the greatest reason to, because it's there, because people are talking about multiple sclerosis awareness. What a better time to get started with this month. So go to it's nmss.org and look, and there's buttons, there's information on advocacy, just to get involved, to get into action alerts, to write letters. That's the thing, it's the voices and it's building the relationships. I think that's where we've built relationships with our legislators over the years.
And with the community, with the MS community, find other activists, because they're not hard to find. Remember, there's a million of us out there, but people that care about getting our voices out about the reality of life with multiple sclerosis. And remember, you're not alone, and our voices are important.
Thank you all. And I mean, go to, if you're on Twitter, just do hashtag MS activists or hashtag MSPPC19, just to check out some of the incredible photos. I mean, people from nationwide, all the activists that were there, look at the photos, see the action that people are taking to make this happen. Check us and let us know how you're advocating for MS. You can find us at danjenniferdigman.com or on Twitter at danjendig. Thank you all for listening to A Couple Takes on MS again, and we will talk to you next time. Take care.